Honestly speaking, cancer treatment is easily one of the most costly and draining experiences anyone can go through. Medical professionals all agree that early detection is the key to high cure rates and longer survival times. That's exactly why I keep urging my overseas friends to get regular health checkups. For any serious illness, early detection, early intervention and early treatment are always the best approach. Hi everyone, I'm Joey. Today we're going to talk about a topic most people tend to avoid, yet everyone needs to understand: cancer treatment. Let me break down the 3 globally standard cancer treatments in plain language: surgery, radiotherapy, and chemotherapy. Simply put, cancer refers to malignant tumors where cells grow uncontrollably. Left untreated, they will keep spreading and worsening. Surgery aims to remove as much of the visible tumor as possible to buy time for follow-up treatments. However, it can only cut out what the human eye can see. Tiny cancer cells lurking in surrounding tissues often remain, which is why radiotherapy and chemotherapy are necessary to wipe out any leftover cancer cells. Let me briefly explain the differences between these 3 methods to make it easy to follow. Radiotherapy uses high-energy radiation to kill cancer cells, making it a form of physical treatment. One downside is that certain types can cause long-term side effects, so choosing the right radiotherapy technology is critical. The 2 main options are photon radiotherapy and proton radiotherapy. Proton radiotherapy is widely recognized for its minimal side effects and superior safety. It is usually the top choice for childhood cancers, as well as tumors located in sensitive areas such as the brain and chest. Chemotherapy, by contrast, is a drug-based treatment with no radiation involved. While it brings noticeable short-term side effects like hair loss and nausea, it rarely causes long-term complications. These days, chemotherapy has become one of the most commonly used auxiliary cancer treatments. Today we'll take an in-depth look at proton radiotherapy, the gold standard radiotherapy option for cancer. Its key advantage over conventional photon radiotherapy lies in a physical property known as the Bragg peak. You can think of it as precision-targeted detonation. Before reaching the tumor, proton rays release very little energy, so healthy organs remain unharmed. Once they hit the tumor, they unleash their full energy to destroy cancer cells precisely, then lose all energy immediately after passing through the tumor. This means only the tumor gets targeted, while all surrounding healthy tissues are fully protected. On the other hand, photon radiation fades slowly as it travels through the body, damaging healthy organs along its path and often leading to numerous long-term complications. That explains why many people opt for proton therapy whenever they can afford it. Most people know proton therapy delivers excellent results, but they assume it comes with an astronomically high price tag out of reach for ordinary people. I'll share the actual costs in Singapore and China for a clear comparison. Proton therapy is expensive mainly because the equipment costs a fortune to build and install. Singapore only introduced its first proton therapy device back in 2023, and the local fees are extremely steep. Treatment is charged per radiation session at roughly 2,800 Singapore dollars each. A typical full course requires around 30 sessions, bringing the total to about 84,000 Singapore dollars, equivalent to nearly 500,000 renminbi, way beyond what most ordinary people can afford. China offers an incredibly cost-effective alternative. A maximum price cap has been set for proton therapy across the country. At most public hospital proton centers, the full radiotherapy course tops out at only 170,000 renminbi, just 1/3 of the cost in Singapore. Lower prices do not mean compromised treatment quality or patient experience, which are fully comparable to those in Europe, the United States and Singapore. China's proton therapy sector has developed rapidly in recent years, with state-of-the-art equipment matching international standards. Thanks to its large patient population, radiologists here gain extensive hands-on experience from countless clinical cases, allowing them to develop highly effective treatment plans tailored to Asian patients. What's more, domestic proton therapy centers offer comprehensive supporting services, with inpatient treatment available and private single rooms provided for privacy and comfort. Let's calculate the total expenses using the Hefei Proton Therapy Center as an example. The radiotherapy fee is capped at 170,000 renminbi for a full 60-day treatment cycle. Additional costs including hospital accommodation, blood tests, imaging scans and auxiliary medications only add around 30,000 renminbi. All in all, a complete proton therapy package costs roughly 200,000 renminbi, among the most affordable rates anywhere in the world. Planning your trip is also hassle-free for international patients. In many countries, patients have to rent accommodation and commute back and forth to the hospital, which wastes plenty of time and money. In China, you can be admitted directly upon arriving in the city where the treatment center is located. Everything including accommodation, meals and medical care is arranged on-site, saving you the trouble of housing and travel logistics. It's no surprise that growing numbers of overseas Chinese and international patients travel to China for proton cancer treatment, drawn by its outstanding value, world-class medical expertise, minimal side effects and premium patient experience. I will release more videos in the future breaking down surgery, chemotherapy and photon radiotherapy to help you build a complete understanding of cancer treatments. Alright, that's all for today. If you enjoy our channel, please click the subscribe button. Thank you everyone.